New South Wales Premier Gladys Berejiklian says there needs to be respect between state leaders after WA Premier Mark McGowan criticised her handling of the pandemic. For more, I'm joined by Charlotte Mortlock, who is at New South Wales Health for us this afternoon. Good afternoon to you, Charlotte. A war of words has erupted now.
Yeah, it's continuing to really, unfortunately, get more and more nasty between the Western Australian Premier Mark McGowan and the New South Wales Premier Gladys Berejiklian. Of course, we know that New South Wales has now welcomed back more than 100,000 returned travellers, and they are Australian citizens, but not necessarily New South Wales residents. Because of that, the Premier says that all states should be grateful for the extra weight that New South Wales has been carrying and also the associated risk with those returned travellers. This follows the Western Australian Premier Mark McGowan criticising Gladys Berejiklian's handling of the pandemic, saying that she should be trying to eliminate the virus entirely. Ms Berejiklian has spoken out this morning saying that her strategy is perfectly aligned with National Cabinet and that any attempt to try and completely eliminate the virus is unrealistic.
The restrictions we have in place now are to get to zero community transmission. I don't think there's any state in the nation that hasn't had cases come up in hotel quarantine, so to suggest that you can somehow eliminate the disease from Australia I don't think is realistic. But I don't believe keeping your borders closed and inflicting pain and suffering on thousands of people is the way to go.
The West Australian Health Minister Roger Cook says that he understands New South Wales is doing the best it can under the circumstances, and he respects that each state has to deal with the virus the way they see fit.
I'm not here to judge New South Wales. I'm here to make sure that we protect Western Australians. New South Wales are doing the best they can under the circumstances that they have. In Western Australia, we have a different set of circumstances, and we are trying to do our bit to meet the national goal of zero presence of the disease in the community.
New South Wales recorded 5 new coronavirus cases. Now, one of those is the man we knew about yesterday who presented at Mount Druitt Hospital. His partner has also been diagnosed with COVID-19. One case was already in isolation linked to the Berejiklian cluster. And unfortunately, Julie, we do have 2 new cases that have emerged on the northern zone of Sydney's northern beaches. They are under investigation. But because we are still seeing some community transmission, it isn't likely that New South Wales will see any restrictions easing anytime soon.
Look, I'll be honest, that depends on the health advice, but unlikely given where we're at, because we're still mopping up. We're still seeing community transmission, even though in most instances they're household contacts or people already in isolation, but we have had a couple of examples where they're still unlinked, and that's always concerns.
Concerningly, we saw just over 14,000 tests conducted in a 24-hour period. A few weeks ago, before Christmas, we saw that number peaking at 70,000. So we are rapidly declining, unfortunately. The authorities are hoping that number will stabilise and average at around 25,000 per day.
Yeah, we certainly need to get those numbers up, don't we? Charlotte Mortlock reporting there. Thank you very much.